be here. I suppose for me what strikes me coming at this point in the table is this is probably one of the most complicated referendums we've ever had and can ever conceive of having. There's about 101 different ways of approaching this question, and there's 101 different considerations and more. And the amount of information and the amount of upskilling we're all doing on things we never thought we'd have to know about, medicine and the law and travel and migration and rules and regulations and the legislation in Westminster, and there's so much in here. So what I'm going to talk about is our approach, which is one of many approaches, and I think this is it's like another referendum. You got it down to one nice simple tag, and you kind of knew what you were voting for. In many ways, it doesn't really, for us, it doesn't particularly matter which approach you approach from. In Rape Crisis, we've been looking at this for, oh gosh, we were there about 5 years ago, beginning to look at this. And one of the things that we're advocating for, and we're supporting people who are facing really complex choices. So the survivors of rape who are pregnant following rape, they face all the difficulties that we're used to hearing about in terms of any woman who's facing a crisis pregnancy, or any girl or any child who's facing a crisis pregnancy. And then on top of that, the complication of sexual violence and the circumstances of conception. For the rape crisis sector, it's not complicated at all. It's really, really, really simple. We've had about 45 years where we've been developing what we call a survivor-centred approach. So in many ways, the complicated piece, we support survivors, we stand beside survivors, we walk with them, we provide the care that they need that is led by them. We don't necessarily have to take any position on any of the issues that they are having to deal with. What we do is we walk side by side with them. So for us, it's very, very simple. We support survivors. So if you ask us what our position is as an organisation, on are we pro-life, are we anti, what's our position on abortion itself, and really the answer is, as an organisation, we have absolutely no position on that whatsoever. What we have a position on is we are pro-survivors. We support survivors, we trust survivors, we are pro-survivors. And it's that simple in many, many ways. So let me complicate it now. You'll have heard, all of the complications that someone in a crisis pregnancy will experience. For survivors who are facing into these questions, if they fear they are pregnant, not only if they are pregnant, but if they fear they might be pregnant, and it might well be the first question that crosses the mind of, and indeed many rape survivors have talked about this. One of the first things they thought about after the rape was not dealing with the trauma, not dealing with any of that, was the question of, am I pregnant? Could I be pregnant? Is that something I'm going to have to face before I even think about what's just happened to me, what's just been done to me? And I think it's fair to say that question and the immediacy of that question and the impact of that question would be less if we had a system that did not have, if we had access to healthcare here in Ireland that did not feel that was not going to be a tremendous struggle and additionally stigmatizing for survivors. So if survivors were in that immediate traumatic period straight after being raped, if they didn't know, as people who are grown up in Ireland, who know Ireland, and I'll come to those who haven't and who are surprised by this, but they will know, any woman in Ireland will know that pregnancy and the question of pregnancy is going to be loaded on top of having to deal with the trauma of rape. So in the first instance, if you're taking a trauma approached response to this question of the referendum, we have to ask ourselves, what would be the most supportive thing for survivors? What would be, they're already facing trauma, they're already facing a whole set of questions and a whole set of decisions And on top of that, for a girl or woman, they are also facing who has been raped and is in that fertile age range. They're also facing the question of, am I pregnant? And I think when we look at that, then we go, the most supportive is that they would have access that is stigma-free. They would have access that does not threaten to criminalise them. They would have access that is easy. And I mean easy in terms of it's here, it's at home, it's your local doctor, and maybe you want to go to the doctor in the next village and not the doctor in this village, but that it's not too much of a logistical issue to get to the healthcare that you need. Bear in mind that we're talking about someone who is in the immediate aftermath of a rape. We're talking about someone who is experiencing some level of trauma, maybe an awful lot of trauma. In terms of what happens there, in terms of time is really, really critical here, because what we know is that for a lot of survivors in those circumstances, one of the most difficult things that you grapple with in the first instance is how do you name what happened to you, how do you address it, how do you actually acknowledge what just happened to you, what was just done to you. So the naming of, and as we stand side by side with survivors, one of the things we do is we try to give them the space to find their own words for that, and to do so in a way that they feel safe and comfortable doing in a time that they can do it at their own pace. If there's the risk of pregnancy, that speeds up that timeline, that if you like, takes that timeline somewhat out of our control. So we continue to try to hold that space for someone to come to terms with, to the point where they can name that what happened to them was rape, and or even just that they need to take care of some immediate medical issues. And after that, they can have more time to consider what just happened, what was done to them, and what they're going to how they're going to approach that in terms of how they move forward. The 8th Amendment is at every turn a block to this. It blocks survivors in terms of their immediate, the immediate support we can give them, the information we can give them. It blocks the medical professions around them in terms of what sort of information and support they can give them. It certainly sets up a whole set of obstacles. And the more you layer in, I suppose, the intersectional pieces, the more complicated these decisions become. So one of the other things to consider around rape and sexual violence is that about 80% of all perpetrators of sexual violence are known to the victims. So we're not just talking about a set of decisions about your body and physically. You're also talking about a set of decisions that will have an impact on your community, your family, your life, your work, your profession. You are talking about disrupting that circle of the people you know and the community you move through by essentially speaking the truth of what was done to you. And every case will be individual. It may well be a very close family member. It may well be someone in your workplace. It may well be someone in the more extended. But any survivor in that circumstance has an individual set of decisions to make about, if you like, a risk management to make about just what impact that might have, just what supports they might need, in terms of who they might need to have with them on that journey as they even disclose to themselves, because there's an element of, I need to tell myself what just happened here, I need to name it for myself. So the ripple effect of that, if they are then on top of that, if they, for example, haven't grown up in Ireland, and they actually, the situation under the 8th is a surprise to them when they're facing this crisis, when they turn up to their doctor and they learn that actually this isn't an option in Ireland, and then they get no information, and they're abandoned, if you like, and we've heard many people talk of that. Even worse if they have no papers, if they're asylum seekers, and of course we're talking about more increasingly vulnerable people. If they're asylum seekers, if they're living in direct provision, maybe they don't even have good English and maybe nobody to translate. And how do you begin to provide information and support for that person in a way that they can, because what we've asked all girls and pregnant women to do here is we've asked them to take full responsibility and to take, to have to do this in an unsupported, isolated, solo way. We already do that with all survivors of sexual violence. We isolate them, and then if they're pregnant on top of that, we've doubly isolated them, we've stigmatized them, and indeed our law says we're going to criminalize them as well if they make that choice. In many ways, rape is something that simply adds, if you like, doubles up on the trauma and difficulties that are the obstacles that the 8th Amendment puts in place. And I'll just be very brief. I was going to be much briefer, and I found I've a lot more to say than I. It comes to the question of, okay, what do we do in terms of taking out the 8th Amendment? That's the obstacle. So we're together for yes, even though that because we are with survivors, because we trust survivors, because we are pro-survivors, we have to be pro repealing the 8th Amendment. In terms of then what do you do for legislation? And it's been mentioned already by some of the speakers, the question of, for survivors of rape, they will probably later than most women, probably be later to the realization that they're in fact pregnant. They will need time. They will need more time in the first instance. So that 3 months is a window within which they have the time to at least find a way to recognizing and some window of time to make a decision and have some options around that pregnancy in that first 12 weeks. But the really critical piece about this, because people, the polls consistently indicate that, for the majority of Irish people, they're pretty compassionate, for the rape survivors who are pregnant as a result, and they really do want them to have access to this healthcare. The problem is, how do you do that? You can't. Well, we've looked at it every which way, and there's no way to do this with a so-called rape clause. You can't say we're going to give survivors of rape access in particular, because what that means is you're going to ask survivors of rape to prove that they were raped. And I think it's abundantly clear to everyone in Ireland, given the last 6 months that we've had, that proving rape is an extraordinarily difficult thing, and it's an extraordinarily trying process, and takes quite a long time. There is no medical way to prove it. There's no objective medical test for rape. So asking any rape survivor to prove rape simply is unworkable. And not only is it unworkable on a practical level, it is also going to be deeply traumatizing and stigmatizing if we even attempt it. So it wouldn't in itself be ethical to even go down that route. And that is why we're very strong on the 12 weeks. Is a really critical, on health grounds, 12 weeks, a woman on request, with the conditions in there in terms of the medical support that would be with it, and the advice and information that would be around it. That is the option that would allow for the Irish people's will, as laid out in the polls, and I hope followed through with the referendum and a yes vote. That is how we put that in place. That is how we give survivors of rape access to the healthcare that I think we all want them to have, and the compassion and the care at home that we think that survivors of rape should have. So thank you very much.